Dr. Madan recently earned his PhD from the MIT Media Lab and is founder of the startup Ginger.io. His research interests are in modeling human behavior using large-scale mobile phone sensor data and applied machine learning and data mining.
Thanks for having me here. My name's Anmol. As you heard, I'm a computer scientist by training. Still learning a lot about health. My background personally is in modeling large amounts of human behavior data, so similar to Nathan and some of the other folks presenting today. So I finished my PhD a year ago and was on the postdoc path, but then ended up starting this company, Ginger.io, which is actually very closely related to the work I did for my thesis. And I can give you both the sort of quick researcher perspective, but also sort of what, how it's actually growing as a commercial product. So one of the fundamental things I've learned over the last year is there's sort of a shortage of real-world objective patient behavior data. And having more data gets us to better health outcomes. And the challenge is a variety of these traditional sources don't really work, right? So it's really hard to get patients to fill out surveys. It's, a lot of these personal health record systems like Microsoft Health Vault and Google Health were all empty databases. There's a challenge across trying to get this sort of real-world objective data. And it's actually a really expensive problem. Across the industry, it's billions of dollars are spent every year. And what's fascinating, though, is we're at the cusp of this really interesting opportunity, right? Everybody's carrying a mobile phone. And these phones are incredibly powerful sensors of a person's life. They have location information, they have calling, texting, accelerometers, a variety of other sensors that you can use. You can interface them with your Fitbit. You can do all this other stuff with it. And Ginger.io is essentially about collecting and analyzing passive data that exists on mobile phones already to understand how patients behave in the real world at scale. Right? So a lot of it is going from millions of location samples or call logs or accelerometer samples to saying something interesting about the patient in the context of that chronic condition or that particular patient population. And the way it works is users simply install an app, and the app collects passive data. So today we support these sensors. The interesting thing is for a substantial part of the population, people usually keep their phones very close to them. So unlike using some of these specific hardware sensors where they have to remember to charge or they have to remember to plug it in, you don't necessarily have that issue with mobile phones today. And then you can also do active data with it. So you can send, you can send them questions if you want to ask them questions. You can send them messaging, notifications, a variety of ways of engaging with the patient. And the background here comes from several studies that were done at the Media Lab, where I got my PhD, and some of my other collaborators have been working on the space. And one study which I can talk about very briefly, spend maybe a minute on, was around 320,000 hours of data, 80 participants over the course of a year. And essentially what we saw was these statistically significant changes in just the mobile sensor data alone for the days that they were sort of normal versus the days that they reported that they were experiencing some of these symptoms. So I'll give you two sort of examples here. For freeware, especially if you look at it on the right side, it gets really interesting. That's Wi-Fi-based entropy features captured from their phone. Really big difference for a normal day versus a symptomatic day. And influenza is very similar, and we actually had an epidemiologist label our influenza samples. Or another one, which we thought was very interesting, was sad, depressed, and lonely. So you start seeing these trends where individuals are basically isolating themselves. So they spend less time on the phone. They have fewer unique contacts. Their movements are more predictable. Their proximity to other individuals is more predictable. And all of this is coming from the sensors that already exist on their mobile phone without them having to do anything extra. And so that's an interesting idea, because if that generalizes across the population, you could do very interesting things in the context of healthcare. You could build, say, a check engine light for every person that sort of goes red, yellow, green, obviously conditioned on the specific complications or chronic conditions that they're trying to manage. And so today we're deploying the same sort of approach for a broad variety of conditions where you would expect, where medical literature suggests there's a behavior change in the patient on the days that they're symptomatic. So mental health, depression, bipolar disorder, you'd expect patients to behave a certain way when they have a flare-up, and I can go into other examples as well. And so when I did my thesis, I had to write about 50,000 lines of MATLAB code just to get the data in a form that it could be analyzed before I had any interesting analyses. And one of the things we've built is gone from that sort of grad student project to a real commercial scale system. So this is an example of a patient dashboard, and so actually our system is live with several institutions. I'll come to that in a bit. Or an example of some of these sort of basic analyses you can do within the system itself, so you don't have to export it as a CSV and go to R if you don't want to. And in terms of, we've been around for about a year, but it's been a busy year. So we're working with a number of different partners. On the sort of provider side, we're working with Cincinnati Children's and also a couple of other partners in the Boston area. And then across the spectrum, there's a lot of interest in getting better behavior data, being able to manage patient populations better for these chronic conditions. So that's been an interesting area for us. A fair amount of press, if you saw us on some of the news articles. And then we recently also won the sort of data design diabetes competition. This was by Health and Human Services. And so the idea, sort of our specific implementation here was essentially for type 2 diabetes patients from the point that they're diagnosed to the point that they potentially become insulin dependent. There's this period where they're at very high risk for sort of stress and mental health issues because you have to change your lifestyle. It's a very big change. And mental health issues in that period can have a much higher likelihood of sort of readmissions, emergency room visits, all sorts of bad things happening to people. And so our specific implementation was using our system for that patient population, and so we got a fair amount of press for that. So that's all I have today, so look forward to the panel.